All right, let's talk about COVID-19. Quick look at the numbers first. 1.68 lakh fresh cases in the last 24 hours. This is the update. We get 8 every morning from the Government of India and the All India figure. As India battles the third wave, we are also seeing a rise in cases in Delhi, over 21,000 cases. That's the figure that's come in this evening, while Mumbai is now dropped to less than 12,000 cases. The overall All India figure has also reduced compared to yesterday. What we're asking on the show today is this the beginning of the end of the third wave, or are we being too optimistic and preempting this? Is, as many scientists say, Omicron heralding the end of the COVID-19 pandemic? To answer some of those questions, I'm joined now by Dr. Shashank Joshi, who's a member of the Maharashtra Covid-19 Task Force, and Dr. Ramanan Laxminrayan, director of the CDDEP. We'll be speaking with Dr. Chandrakant Lahariya as well in a short while from now. Dr. Joshi, let me begin by just getting a take from you and an understanding on what's happening in Mumbai. We saw 3 days of plateau in numbers, around 20,000 a day. And then a sharp drop starting from yesterday, about 17,000 cases, down to less than 12,000 cases today.
That is correct. So whether this is epiphenomenon, whether this is due to a lot of people who are staying at home and not testing and self-isolating, or self-testing and not reporting, we don't know. But one thing is clear-cut, that the current trend is reassuring that the test positivity rate is dropping down. And if you talk anecdotally to the general practitioner population also, there is a little dip in the flu-like syndrome which was observed in the last 2 weeks, which was tsunami-like. But clearly in the Omicron pandemic, we all know that 80% of people are asymptomatic or mildly symptomatic. It is the people who are getting hospitalized, the ones who are needing oxygen, the ones who need the ventilators or the death. Those are the numbers to follow. And even in these numbers, we are seeing a substantially lower number for the percentage of number of people which are having COVID positivity compared to the second wave. So clearly we can see that these are early signs. We do not know whether this is a lull before a storm or whether this is a true flattening. Another couple of days, we will have a clear idea on that. Next 2 weeks will be crucial to understand the nature of hospitalizations and deaths which will evolve, because you remember that always hospitalizations have a 2 to 3 week lag. So our fingers are crossed. Let's be cautiously optimistic, cannot let our guard down at all. And let's hope that this trend of flattening continues. And if we are following the South African way, like the way it was seen in the Gauteng province, this probably is seeing a similar trend to that, then probably this may be a reassuring trend. So probably by the end of this week and next week, if we have numbers which clearly show a test positivity rate declining and hospitalizations remaining stable and manageable, probably we can say that currently we are at the peak and we will start seeing a decline very soon.
Dr. Ramanan, this is only about the Mumbai numbers. We've seen an increase in Delhi. Meanwhile, other states are showing also a steady increase. But do you think that we're also seeing a different pattern this time around, perhaps in the big cities, where a lot of people are maybe testing at home and, just self-isolating because the symptoms don't seem to be too severe?
Absolutely. I think a lot of people are self-testing with home kits, or they're testing outside and then, self-isolating. So that certainly seems to be the case. And I think our level of undercount for this Omicron wave is probably higher than for previous waves. I think, as Dr. Joshi mentioned, this is because, the vast majority are going to either be asymptomatic or have fairly mild infections. But that said, I think it is too early to say that this wave is over nationally, and it's also too early to say that the pandemic is over, because this is certainly not going to be the last variant, and we still have a ways to go. So if we get through this wave without too much damage, we should consider ourselves lucky, but this is not the end.
Okay, that's an interesting point, Dr. Ramanan, and I would request you to elaborate on it. So a lot of reports and quotations of scientists around the world keep talking about how Omicron may herald the end game simply because it's replacing Delta at such a furious pace and seems to be less symptomatic or less harmful than the Delta. Do you subscribe to that view at all?
We don't have strong evidence on this. So you have to keep in mind the Delta wave came at a time when vaccination coverage was negligible in the country. And this Omicron wave is coming at a time when there has been significant exposure in the country to previous waves, particularly Delta. And also we've had, fairly reasonable vaccination coverage, 60+% of the eligible adult population. So, we can't really compare Delta and Omicron because the immunity of the underlying population has been very different. It seems to be the case that Omicron, even in unvaccinated people, is perhaps, a milder infection, but I don't think we have large-scale data to really prove this. So, unless, I think the jury is still out in terms of what to make of this. The second point is really that keep in mind that even people who are double vaccinated, sometimes even triple vaccinated, have had an Omicron infection. So we know that there is some cross protection and protection from the vaccine, but we have no idea what the future strain variants are going to look like. A good template for this is influenza. Influenza comes back every year. Some years the flu season is bad, some years is not so bad. But the nice thing about the flu season, at least, is that, it's much more of a temperate zone disease than it is really a tropical disease. Whereas, COVID unfortunately seems to love the heat, seems to love the cold, seems to love all temperatures, and thrives very well, in all countries around the world. So, COVID worries me for that reason, which is that I don't think we've seen the last of it yet. And last point I'll make is, people always ask, but is it going to become endemic? Endemicity is not a solution. Malaria is endemic in Africa, but you don't want to get malaria. Tuberculosis is endemic in India, but you don't want to get tuberculosis. Endemicity doesn't mean the disease has gone away. Endemicity simply means that it has established itself so well in the population that its patterns are relatively predictable. And I think that is what is happening with COVID. It is becoming endemic, but I don't see that necessarily as something that we should say, well, now we're out of the woods. I think we still have to now live with this new disease that 2 years ago we never had this disease. So, we are in a different post-COVID world in that sense.
Now, so one more follow-up question to that, Dr. Ramanan, a little from the policy point of view, because right now what a lot of people want to know is this up and down in their lives going to continue, where you see recession in cases and things come back a bit to quote-unquote normal, then you see a surge in the cases maybe fueled by another variant or something like that, and then restrictions begin again. So are we going to see this ebb and flow as a cycle, or does policy response also now need to evolve?
I think for at least a year now, the policy response should have evolved past lockdowns and curfews, which I feel are completely ineffective. With the highly transmissible respiratory pathogens like this, there is some amount of personal protection that's involved. There's certainly a need for the health system to be ready for it. And we certainly need to also, respond with stopping mass gatherings where possible. But many other things which I don't think have really helped, which is, shuttering the schools, for instance, has not been a good idea at all. We've made some choices which I don't feel like we've really thought through what the long-term consequences of those are. And I think going forward, we do have to return to a sense of normalcy and get away from the counting of cases, which I don't feel that the test, track, contain strategy is really very helpful for COVID any longer. I think we really need to move to a look at hospitalizations, looking at how to manage patients, looking at keeping our health infrastructure up to snuff. And then, of course, the most important thing is really further ramping up the vaccination program. I think the vaccine program in India has done extremely well, but even so, I think we need to get to that 90% coverage amongst adults. And that will be our exit strategy from COVID, as I'm sure every COVID expert on your show has said, which is vaccination is our long-term exit strategy. And we need to be single-minded about focus on that. And once we have the vaccine, coverage, I think we'll be in a much better place.
Yep. Dr. Lahariya, great to have you on this conversation as well. Let me start with the basic premise of this discussion today. And we're taking a page out of the book and out of the fact that Mumbai numbers seem to have behaved well. We're not calling it the end of this wave or anything. It's preemptive to do that, and Dr. Joshi has explained that. But what I'm trying to understand is there any strength to the argument that the Omicron seems to be displacing Delta fairly quickly and is in that sense heralding the end of the COVID-19 pandemic? Do you subscribe to that?
So the first part of the argument stands true. We know that wherever Omicron has been introduced in those settings, it is more transmissible, and that approach, it has replaced Delta in most of the settings, or it has become a predominant in those settings. But whether the Omicron is going to be the end of the pandemic, we really cannot say. Nobody can really say that. Of course, there are many other factors which we need to remember, that when Omicron has emerged as a variant of concern, by then it's 2 years. And in the last 2 years, people have developed natural infection, people have been vaccinated, and of course, in that setting, Omicron is emerging. I also want to flag that while we are talking about that Mumbai has plateaued or Delhi has plateaued, but we need to remember that in the last few days, Indian government has changed the testing policy. So what is happening actually, that now that as per new policy announced yesterday, the asymptomatic contact need not to be tested. So we know that in Omicron, there are large proportion of individuals who are asymptomatic. This proportion was like 85% or so in most of the settings where Omicron is dominant. With the new policy, asymptomatic individual or contacts not requiring testing, it is normal that the numbers would go down. So essentially this comparison or the trend is not fairly comparable, because the numbers are going down currently due to the new testing policy. So we really need to watch, and then we can conclude whether cases are coming down or a city has peaked or not peaked.
No, completely fair enough. That point taken. Dr. Joshi, you want to come in on the aspects that we've discussed so far, especially 2 points I want you to comment on. One, of course, whether Omicron is going to be ending the pandemic. And second, the point that Dr. Ramanan was making, that now over the last 1 year, we have to do things differently. Curfews and restrictions are not working. We need to understand that when we make policy and change our tactic.
So I think one thing is very clear cut, that Omicron, I would agree with Dr. Lahariya, is not going to be the end of the thing. We will have to still wait and watch. It's premature. And of course, testing policy only changed yesterday. So I don't think the Mumbai numbers, as I told you, is more of an epiphenomenon, because people are staying at home and not testing, self-isolating, and or are self-testing and not reporting. So that's the more likely possibility and probability. As far as the changing of the tactics are concerned, I think that is for administration to decide. And the administrators in local geographies take local decisions based on the prevailing circumstances and the overall behavior of people at large. So I agree with him in many ways that closed spaces, congregations, that is a no-brainer, that they need to be avoided. And masking and COVID-appropriate behavior is a norm. So those strategies, as he said, and personal protection and vaccination is the key. So all that is in place. But as I said, ultimately, the administration takes a call on it, and there will have to be geographic-based strategies based on case-to-case basis on various decisions taken by the local administration. So I think that is, a larger policy at large will not be there. We have also seen a change in the stance of
Dr. Joshi. That's true, Dr. Joshi. I'm not alluding that, you were taking those decisions. But the point being, for example, yesterday the DDMA decided to shut dining in restaurants. Other cities have not shut dining in restaurants. Some cities have had restrictions of other kinds. Suddenly there are night curfews and weekend curfews. It's the same set of tools being applied depending on the situation, but there's no clear pattern or sense about why a certain restriction is coming in or whether it's working or not.
I got the point.
My simple question to you is, medically now, do we need to try something else?
So these are not medical things. These are things in public health and public policy making. And a restaurant is a space where unmasking is possible and probable. So decluttering a restaurant, having an open air policy, it depends on the population prevalence on that circumstance for a particular administration to take a decision. So I'm not here to defend or oppose any of these type of a situation. Each geography takes a simple decision, but one thing is very clear cut, that any situation which leads to unmasking puts you at a transmission zone or a transmission risk and a crowding situation. So that part is unquestionable. Now, as far as putting restrictions in place and augmenting them depend on the test positivity rate of that population and the nature of rate of spread. So they take those local regional decisions. Sometimes they may have worked transiently, but in the long run, it is the responsible behavior of human beings and community participation which is the key, for which effective communication, including channels like you all, are doing very responsibly is most important. So I think it is a self-regulation which is the key, that people, when they go to a restaurant or any part of a public place, if they behave responsibly, a lot of transmission can be contained itself. And we have seen this in Asia. A large proportion of Asia, whether it is Taiwan, whether it is Japan, whether it is various other Asian countries, have a masking custom, and their numbers have been very responsive. So we need community participation also when we are looking at these type of situations, rather than just every time putting it back on administration for some draconian policies which have been put in place. But I agree with Dr. Laxminrayan that we need to have a long-term strategy and a vision statement in place so that we can implement this better, because these cycles may repeat. But because we cannot predict that another variant may be less harmful or more harmful. It is likely that this could be the end game, but it is all, the only thing we know about COVID is it's predictably unpredictable.
Yeah. Dr. Lahariya, let me come back to the point of what is the exit strategy then. A few minutes ago, Dr. Ramanan said that the exit strategy is to vaccinate 90% of the population. I assume he means twice. We have booster shots going now for healthcare workers and senior citizens. Is that the only way out?
So what we need to remember that even when this Omicron wave will be over, the number of cases would be reported from different settings. So the first thing is that endemicity would settle in, but each of the setting need to determine what is the acceptable level of numbers of cases in that setting, and that is going to happen. So each country, whether it's a European setting, Americas or Asia, or including India, will have to determine that this is what we accept as an acceptable number of cases, which will keep reporting. That's one. Second part is that we, depending upon which vaccines are being used and what is the scientific evidence available, including the factoring in the aspects such as natural infection followed by vaccination or vaccination followed by natural infection, all those factors, country or different settings need to determine the frequency at which target population at what interval need to be given booster doses. So those would continue. Third thing is that we need to remember, and this has happened 5 times in the last 2 years, that a new variant of virus emerged and which has a different characteristic. So we cannot rule out that there would not be a future variant. And since there would be variant, if it is more transmissible, it's very likely that the cases might rise even in that period when the disease is endemic. So what we need to learn, and every country need to learn, in my opinion, is something that while most of the time cases are at stable level, so the standard of care is being provided and public health approaches are being followed, but there would be a particular pattern, a new variant emerge, and that is resulting in increase in the cases. And that time, quickly that public system need to be geared up. Preparedness and response to that system is something like what we call in people who live in the coastal areas. And if there is a cyclone coming in that setup, we know the cyclone come frequently. So most of the time you are living a normal life. But then if you know there is a cyclone alert, then people quickly get ready for it, respond to it, and then cyclone is over, you return to the normal life. And that is what could be the future of COVID-19 pandemic, vaccines, COVID-appropriate behavior as per depending upon local epidemiology. But when you know there is a new challenge, you respond to it through the public health measures.
Yep. So wave after wave could come ahead as well. We need to figure out what our action plan will be. Will we fall upon the same tools Will we lower our expectations in terms of the number of cases that are tolerable at a policy level? Some important questions and points being raised in the debate this evening. Thank you so much, gentlemen, for joining us on the lead story on the India Development Debate.